Supine active overhead extension exercises are a very useful exercise that I use in patients with elbow instability, either immediately after an elbow dislocation or after ligament repair surgery. We ask the patients to do this exercise lying down and to bring the affected arm up so that it is vertical and support it with their good arm. In this position, gravity is pulling the forearm onto the humerus bone. That is inherently more stable and allows the biceps and triceps to relax so that they get more movement. If they try to do the same exercise with the arm at the side, gravity will be pulling the forearm away from the humerus, and the biceps and triceps will therefore be activated and allow a less range of motion. In this position, we ask the patient to try to touch the pillow and point to the ceiling while keeping the arm steady. And they need to repeat this several times a day. Okay, you can put it down. If the patient is then able to touch the pillow easily, they can make the exercise more complex by moving the pillow aside and trying to bend the elbow further so that they touch the bed that they're laying on, and continue pointing to the ceiling.